Hi, good morning. Thank you for coming to this National Lead meeting for Surge Week 2. My name's Liam. I'm one of the research fellows at the University of Birmingham, help to deliver Surge Week 2. I'd first like to say a massive thank you for all of your help and your hard work, collaboration over the last few months, bringing Surge Week 2 to where it is today. And we're very excited for it to launch in just a couple of weeks' time. The presentation will be relatively brief and just discuss the progress of where we're up to today, the current step, which is the co-lead registration, and the mini-team registration form, which we hope to launch soon. And then I'll leave most of the time for questions, troubleshooting and discussion. I think it's a real privilege to have so many leaders from so many countries come together to deliver a study like this. And so I think we'll allow most of the time for discussion. We aim to hold these meetings every 2 weeks to, again, just provide an update and a forum for discussion. Every time we show this map, it seems to be getting deeper shades of blue, which is truly amazing. We've had expressions of interest from over 12,000 clinicians from over 2,000 hospitals in 131 countries. So thank you all for your hard work, as this is really down to you and delivering this through your networks. The study is still open to any hospital, clinician or country that wish to participate. So if you do see gaps on the map or know of anyone who'd like to be part of this, please share the expression of interest link with them. And if you don't have that to hand, just direct them to the surgeweek.org internet page, and there's a sign up link on there. As you know, the structure of the study, so there's one or multiple national leads in each of your countries, and you've registered your hospital leads. The hospital lead is only one in each hospital. They're responsible for the local regulatory approvals and completing the hospital site survey at the end of the study, and are currently registering their co-leads. Their co-leads can be as many as they wish to have in the hospital, but we suggest that maybe one per specialty participating in the study is the most straightforward and simple method. And then shortly, the mini-team forms will open, and that will be accessed by the co-leads within a hospital and also the hospital lead. So this is much of what I've covered already, and each mini-team will consist of 3 people. The 3 people can include co-leads and hospital leads. They will just have to select themselves on the mini-team selection page. And mini-teams collect data on all consecutive eligible patients in their surgical specialty or specialties, which they have selected to participate for. And mini-teams can collect data for one or multiple time periods for one or multiple surgical specialties. So clearly in larger hospitals, there'll be multiple mini-teams working together. Now the co-lead form, my colleagues made some helpful YouTube videos and PDFs to view, but we have almost 4,000 specialties available for co-leads to be selected into, and have almost 1,000 co-leads selected to date. So that process is still ongoing. Clearly we don't need to get to 4,000 for it to be complete. It's not mandatory to have any co-leads in your hospital if you don't wish. They're there just to support the running of the study and recruitment of collaborators in their own specialty. And the next stage is to launch the mini-team portal. And the mini-teams can be configured in whichever way is suitable for the hospital. We think this is probably the most simple method. So you have all of your surgical specialties in your hospital, and you have a mini team for each specialty, and they collect data for all 6 periods. This means that everyone in the hospital who wants to participate can do, and collects a lot of data for that hospital. Now, in this hospital, you can see that they have general surgery and orthopedics, but they don't have urology and ENT. Therefore, people cannot collect data for urology and ENT. But you may be in a situation where you have more collaborators than just 3 per specialty. And so what you can do to ensure that everyone has the opportunity to participate is to divide the time periods up so that each team takes different time periods across the surgical specialties. And that means that we collect lots of data, and everyone who wants to be part of this study can be. A less preferred option is this one, where you have all the specialties but maybe not as many people interested in participating, and it may not be possible, therefore, to collect data across all of the periods. So you may choose to select just a number of the periods for each of the teams, which is acceptable, but less preferred than the other options. And these are the surgical specialties that you or your colleagues will be able to select for the mini teams. And so you will select the specialties that you wish for the first mini team to be part to collect data for, and then here we'll provide the names of the people in your hospital to select their names for that mini team, and then you'll click save and go on to your next mini team. We'll do a full run through of this through a YouTube video, and we can discuss this later in the discussion part of the meeting. So to bring the slides to a close, all of the documents can be found on the SurgeWeek website. We have a number of social media pages where we are trying to provide regular updates for people. And if you do have any questions, please feel free to email me, or you can direct people towards the SurgeWeek inbox. So I'll open the floor now to questions. Just before I do so, I'd like to say a massive thank you for all of your help and your hard work and collaboration with this. It's really exciting, the momentum building and the number of collaborators increasing, and we look forward to this launching on the 31st of August. So I'll now open the floor to questions. Thank you very much.